Hey everybody, this video is going to be super special because the NHS is actually making huge inroads into making sure that patients have access to absolutely fantastic healthcare. And today what we're talking about is a big topic and it's called Pharmacy First. So whether you're a patient, whether you're a pharmacist, this video is absolutely relevant for you. So I need you folks to subscribe, like and share this channel. And I've got my good friend here who we're going to call Farouk, which is the paper. It's actually not Farouk. Farouk's actually making the video, but I'm going to be explaining to you everything that you need to know about Pharmacy First, and then a special announcement that I need you guys to wait for at the end of the video. Even Farouk doesn't know what this is, but a special announcement I'm going to be making at the end of the video, and we'll be discussing that later on. So follow me, folks, and let's talk about Pharmacy First. So first of all, what is Pharmacy First? Well, it's a government initiative where, in simple terms, what they would like is pharmacies to be able to manage, diagnose and treat common conditions that are normally seen by the GP and may require prescriptions, so now they can get dealt with within a community pharmacy. So what that means is that if you're suffering with these conditions, which we'll go through in a moment, you can walk into your pharmacy, be seen by a trained professional, get the diagnosis, receive great healthcare and the medication if it's required, so you can get better sooner and faster without having to wait for a period of time to see your GP. That is the whole crux of this Pharmacy First service. And you might be thinking, well, why pharmacy? Why in pharmacy? Well, the reason is because majority of people within this country have a pharmacy within a 20-minute walk, and in some places even less. So it's very much accessible. In actual fact, pharmacy and a pharmacist is one of the only healthcare professionals, even if you don't talk about healthcare professionals, the only professional that you can get hold of without an appointment. And I'm going to focus on this. Think about this. If you want to get a haircut, you want to get your nails done, you want to go, wherever you want to go, you need an appointment. Even if I want to see Farouk, who helps me with my videos, who inspires me, I need an appointment. But a pharmacist, you can walk into a pharmacy and they're absolutely readily available. They're trained, so it makes sense. So that's the reason behind it. So, Pharmacy First. I've explained to you about what is Pharmacy First. I want to now focus on something else, and that is, why did we start Pharmacy First? Why did the NHS invest in Pharmacy First? And my colleague behind me is a famous TikToker, and he's looking, he's smiling, and now he's become shy. I don't know why he's become shy, but he's an absolutely famous TikToker, so I don't know why he's become shy. But hey, Bilal, you can say hi on the camera. He's saying hi, so which is good. Anyway, let's forget Bilal for now. The key thing that I want you folks to focus on is why Pharmacy First. Number one, there's a shortage of doctors in this country. Not only in this country, but in pretty much all over the world, there's a shortage. We know that there's 2.8 doctors to 1,000 people within England and UK. So you can see it is difficult to get hold of a doctor. We also know that NHS waiting times, which is where you should see a hospital doctor within 4 hours, haven't been met yet, unfortunately. We also know that we're living longer, but we're living longer with disease. That's the problem. So the issue isn't that we're living longer. The issue is that we're living longer with disease, for example, diabetes, cholesterol, asthma, COPD, and so on. So it's inevitable that you need access to healthcare. So what the NHS is saying is, why don't we invest in other professionals who are trained? And keep in mind, a pharmacist is qualified for 4 years, has a master's qualification, and it's a regulated profession. Why don't we invest in other professionals so they can help the NHS? And that's why they've come up with the Pharmacy First service, where a pharmacist can see you for a list of 7 conditions to start off with, to make sure that you can be safely seen and diagnose, manage and treat. When it started was in around January 2024. So January 2024 is when it started. That's when it started, around the 31st of Jan. And the service includes 7 conditions. Those 7 conditions are: 1, sore throat; 2, earache; 3, we have shingles; we have 4, insect bites; we have 5, which I forgot as well, which is uncomplicated UTIs. And we also have, and let's have a look at our good friend here, we also have, what else do we have here? We've got sinusitis, and earache. So these are the 7 conditions that you can walk into a pharmacy, be seen, and receive treatment if it's necessary, which is pretty cool because they're common conditions that we get all the time, and it means you can see or can be seen by a professional and so on. How do you access the service? Well, you can access the service in a number of ways. Number 1, visit your GP and they can refer you to a pharmacy. Number 2, you can directly go visit a pharmacy. Number 3, a GP can refer you, or NHS 111 can refer you. So you can see that's very much accessible. You can also walk into your pharmacy and it can be done pretty straightforward. How do you access the service? We've discussed this, so that's fairly straightforward. Now let's go on to what happens. So, and Farouk can follow me across here. Let's say you visit a pharmacy. What will happen is the pharmacist will then assess you. So they'll do an interview or a consultation process. They'll understand what your signs and symptoms are. They'll then start to link those signs and symptoms to the disease that could be causing it. They will then write out a prescription for you and you receive your treatment. And they may need to undertake an examination as and when required. Now, pharmacists, for those of you who want to develop your clinical skills and want to make sure you feel confident in these conditions, get in touch with us at Medlearn and absolutely you'll receive training and we'll make sure that you can safely diagnose and manage and treat a wide range of conditions. Visit us at medlearn.com. So now that you understand what's going to happen, let's think about how to find a pharmacy. Pretty much straightforward. You can find pharmacies pretty much everywhere, or you can visit the NHS website. Will I have to pay for medications? That's a question that most people ask. Well, if you're exempt and you don't normally pay for medicines, then you don't need to pay. If you would normally pay for your prescription, then it's a simple NHS charge. So you don't have to pay anything extra. That's what you're going to do. So it's similar to an NHS service. You don't pay anything extra. And my cousin and my sister is actually looking at what I'm saying, which is interesting. So she's interested. What are you talking about? And she's smiling as well. We like happy people. We like happy staff, which is great. So what have I explained to you? What is Pharmacy First? It's a government initiative which does not cost you anything as a patient, where you could be seen by a pharmacist if you're suffering with sinusitis, earache, sore throat. We also have UTIs, insect bites or shingles, and we'll talk briefly about those conditions in a moment. I've discussed why the NHS is doing it, because shortage of GPs, improving access to healthcare. I've discussed when did it start, in January 2024. I've discussed the conditions, what happens we've discussed, how to find a pharmacy, and if you pay, we've discussed all of this now. Now, what I want to talk to you about is the conditions itself. And Farouk, if you follow me here, and you can see he's given me a very limited space to walk around. He doesn't want me walking around too much. Let's talk about the conditions. First of all, sinusitis. Now, I'm going to explain these conditions very basic, in a basic form. So if you're a medical professional listening to this, don't give me slack saying you've not explained it properly or it's like this and like this. I can absolutely explain it in a medical terminology. And for those of you who want to develop your clinical skills, get in touch and I'll explain to you exactly through and throughout. But let's talk about sinusitis. First of all, what we have these sinuses. If you go onto Google and type in the human skull, you'll see that you have holes within the skull itself. Now, we don't know exactly what the function for these holes are, these spaces are, but we think it's because it lightens the skull. The problem is that these holes that we find in the skull, they can be filled with fluid and become infected or become inflamed, and then you get sinusitis. So all sinusitis is inflammation or swelling of the sinuses, this space within the skull. Now it can be bacterial. So please folks, it doesn't mean that you always have a bacterial infection and you need antibiotics. It can also be viral. But the symptoms that you're going to have, you're going to feel pressure here. So you're going to feel this fullness. You may have a runny nose and some discharge or something coming out the nose. And when you lean forward like this, it's very, very painful. So these are the common symptoms that we're looking for. If you're suffering with this, get in touch with your pharmacist. They can absolutely help. And you may also have earache as well. Keep that in mind. So that's sinusitis. Let's talk about an earache now, because that can be treated as well. And folks, if you're listening to this, it's fairly straightforward. If you have an earache, either you're going to have pain in the ear itself, or you may actually have something that will come out of the ear, like discharge, because it may become infected. So anybody who has an earache, especially when you touch here, it's painful, if you move the ear, or if you've got a child who's tugging on the ear, has a fever, then get in touch with your local pharmacy. They can absolutely help. So that is about the earache, that is about the sinusitis. What about the sore throat? And we've all had a sore throat. We know what it's like when it's bacterial. You'll have a fever, you'll find it difficult to swallow, you may have pus behind the throat, and you may be generally unwell. Again, get in touch with your pharmacy. Let's talk about shingles. Shingles is a rash that you develop, more common if you're above the age of 50, but it can happen in other ages, but more common above the age of 50. And you get this rash that develops like a band. So like this, like a band. It doesn't normally cross the middle. So it might be this side, but it never crosses like this. It can be anywhere in the body, but normally the chest and the back. And it's a blister, and it's very painful. Initially, you might have a tingling sensation, a burning sensation, just generally feeling unwell, and then you get this rash, which is like a band, and it's blister filled. It's like a blister, so it has fluid inside, and it's painful, folks, and you need to get in touch ASAP. What about a UTI? What about a UTI? So if you've ever suffered with a UTI, folks, you'll know that you have the urge to go to the toilet more. You may have a burning sensation. Folks, you may even feel pain just below here. You may have a bit of pain below here as well. And that is when you'll feel that you need to be seen by a clinician, and a pharmacist can absolutely treat you. Let's talk about insect bites. And it's fairly straightforward with insect bites, folks. Insect bites. What we have, if you've got something that's bitten us, it can be quite itchy, and then you might end up with a red hot area. That's important. And I don't think I mentioned impetigo in the 7 conditions. There's 7 conditions actually, not 6. The 7th condition is impetigo. This is an infection that's normally caused by a bacteria, more common in children. Normally affects the face, the lips, the arms, and other parts of the body itself. And this blister will then start to become golden colored. It might even crust over, and it might start to become a bit brown as well. That is impetigo. So we've discussed all the conditions, and what I want to let pharmacists know, for any of you folks who want to develop your clinical skills, I'm making a special announcement that we will be teaching all these conditions in depth as part of our Pharmacy First course from start to finish. We are going to explain to you exactly how you diagnose this, how you treat this, how you manage this. So get in touch with us at Medlearn, and together let's build a better world and let's make a difference. Thank you for watching. Bismillahirrahmanirrahim. 1, 2, 3, action. Hello.
Why you are waiting there?
He's waiting because he wants to go. He wants to go past.
When you're recording, don't worry.
Ready. 1, 2, 3, action. Bismillah. Let's get in the right position. Bismillah. La ilaha illallah. 1, 2, 3, go.